Morning. Yeah. I'm not sure what that says about you or me. Yeah. So good afternoon. It's great to be here at the vaccination clinic at the Oceanside Event Center here in Revere. I do want to say hello to the mayor. It's nice to see you. Long time no see. We got a chance to talk to the folks who are running the operation. I want to take this opportunity to thank the Guard for the assistance they're providing East Boston Community Health Center, both at their East Boston facility and here in Revere and in so many places and spaces across the Commonwealth. I also want to thank Manny, Lopes, and your team for continuing to expand your footprint as you seek world domination here in the Commonwealth. The clinic obviously is a partnership between East Boston Neighborhood Health Center and the City of Revere. And Mayor, once again, I want to thank you for your partnership all the way through the pandemic. We've spent a lot of time, we and your team, talking about all kinds of things since this all began a little over a year ago. We're going to provide a quick update on our efforts around vaccine equity, including right here in Revere. But first, I want to give a quick update on the state of COVID. First of all, the Department of Public Health reported 1,566 new cases, COVID cases, on about 61,000 molecular tests. We've now done about 19 million, over 19 million tests here in the Commonwealth. 725 patients are in the hospital for COVID and 169 are in the ICU. With respect to vaccines, we crossed over two significant milestones yesterday. First of all, we've now delivered and administered over 4 million total doses to people across the Commonwealth, and more than 1.5 million people are now fully vaccinated. We continue to be a national leader in getting people vaccinated. We're the top state for both first doses and total doses administered among the 24 states that have more than 5 million people. Our progress has been especially notable among those most vulnerable to the virus. Over 82% of Massachusetts residents over the age of 75 have received a first dose, which is significantly higher than the national average, and that helps us keep cases and hospitalizations down among this particular group, which, as we all know, has been terribly negatively affected by COVID. And our vaccination rates among Black and Hispanic residents are about double the national averages, although places like this are part of how we continue to build on the work we've done on that front as we move forward. On Monday, we expanded vaccine eligibility to include everybody over the age of 55 and people with at least one medical condition from the CDC's updated comorbidity list, making another approximately 1 million people eligible to get a vaccine. I'm happy to report that I feel good. I got my first shot yesterday, and I had all kinds of text messages last night and this morning about how I was feeling. It's nice to know that so many people care. That was a joke. Thank you for laughing. And I, you know, so far so good. But as I said yesterday, it does feel like a shot. As more people become eligible, we hope to see continued increase in the supply that we receive from the federal government, because we have tons of capacity we can put to work to make sure that whatever we get through the federal supply process, we'll be able to get into people's arms very quickly. The pre-registration system we launched a few weeks ago is working well. So far, around 1.5 million people have pre-registered, with over 800,000 having been contacted with the opportunity to book appointments. When it was launched, the pre-registration system included all 7 mass vaccination sites, and this week we're adding 2 regional collaboratives to the system as well. Later this week, the Amherst Northampton Collaborative and the Marshfield Regional Collaborative will be on our pre-registration system, and appointments will be offered there for folks as well. We plan to keep adding more regional collaboratives during the month of April as we move forward. And also by next week, the user experience will change for people who are contacted with the opportunity to book appointments people will have the opportunity to select their vaccination location before proceeding to select from available appointments. And we'll continue to make improvements to the system in the weeks ahead and to make the process even easier, especially as we move toward the April 19th date on which everybody will be eligible to pre-register. Today we're here in Revere to spotlight the vaccine clinic here at Wonderland, right off the Blue Line. It's the second time in the past week we've gotten a chance to join Manny and the team from East Boston to talk about their work and to tour one of their sites. That speaks to the work that you and your team are doing for us in some of our most disproportionately impacted communities, and we really appreciate it. Revere is one of the 20 most heavily prioritized communities under our state's equity initiative. These communities were identified based on the disproportionate impact of COVID and key metrics around social determinants of health by the Department of Public Health. And we work with these communities, including Revere, in a variety of ways. We continue to supply their local health departments with new first doses. In Revere, these doses are being used to support homebound vaccinations and other hard-to-reach populations. And in partnership with Archipelago and Healthcare for All, the grassroots campaign has been launched to promote vaccine access and awareness, which includes, among other things, door knocking and canvassing and community events, which are starting this week. And in Revere, this will include 37 bilingual organizers working on the ground. Each community has a designated community liaison from the Department of Public Health to work with the local board to help support the vaccine rollout and to do whatever we need to do to help the folks locally both message and make vaccines available to folks. Earlier this year, we announced targeted investments in community and faith-based organizations doing vaccine outreach in these communities, and organizations doing this in Revere received over $120,000 in grants. Last week, we also announced about $55 million in grants provided directly to these communities to support local public health infrastructure as we move forward, and more funds for these communities as part of the $30 million equity initiative will be forthcoming. Revere is being prioritized for mobile vaccination clinics as part of our partnership with FEMA. This enables us to leverage some of the 6,000 additional doses that we receive every day through the FEMA partnership for hard-hit nearby communities. And these pop-up clinics will be set up in easy-to-access locations based on what works best in each community. There are grassroots teams that will work with community members to help people book appointments at those sites. And these are in addition to the mobile clinics that the city is coordinating here in Revere already. In a minute, the mayor will probably talk a little more about the work that the city's doing to get their residents vaccinated in partnership with the Commonwealth and many other organizations here in the city. We're grateful for the chance to work with committed local leaders like Mayor Arrigo in these prioritized communities. Together, they're helping residents in these communities get access to vaccines and work hard to recover from the pandemic. The vaccine is obviously a crucial part of how we get past the pandemic and help our communities recover and move forward. Getting the vaccine is the best way people can protect themselves, their families, their neighbors, and their communities. The vaccine is safe. It's been through all the same tests and clinical protocols as other vaccines. It's effective against the variants and at preventing people from getting sick or dying from COVID. That's why we're working so hard in collaboration with our partners in local government and many community-based organizations and faith-based organizations to get more shots in arms every single day. I can't emphasize how important it is for people to sign up when they're eligible and to get vaccinated when it's their turn. It is in some respects one of the most important things we can all do to get back to what we might describe as the normal we used to know before the pandemic. And with that, I will turn it over to Mayor Arrigo.
Thank you, Governor. Good afternoon, everyone. I want to thank Governor Baker, Lieutenant Governor Polito, of course, Secretary Sudders, and your entire team, Governor, for the tremendous work and the help. It is great to welcome all of you back to Revere under more optimistic circumstances. I also want to acknowledge and thank Manny Lopes Manny has been a tremendous friend and a partner to the city, and I want to thank your entire team for all that East Boston Neighborhood Health Center has done to help the city of Revere throughout the entire pandemic. And lastly, I want to thank the Oceanside team, Louis and Chuck Del Pidio, who recognize their role in helping the city get through the pandemic and actually came to us and offered up this space as a location for a clinic. 2 weeks ago, Manny and I and many others celebrated the opening of this regional vaccination site as a result of incredible collaboration between the City of Revere, East Boston Neighborhood Health Center, the Commonwealth, the MBTA, and of course, Oceanside Ballroom. This site provides more consistent and available access to vaccination for our residents, and more importantly, for the region, including residents of Winthrop, Everett, Chelsea, East Boston. Most importantly, it frees up our own Board of Health, and I want to give a special shout out to Lauren Buck for the tremendous work that she's done on behalf of our local Board of Health and our local Public Health Department. It allows her team to get into our neighborhoods and our business districts and offer mobile vaccination to our residents who have been heavily impacted by the pandemic. As of last Thursday, more than 10,000 residents of the City of Revere have been fully vaccinated. Another 7,000 have received their first dose. And the Revere Board of Health has worked for months to stand up clinics for our first responders, our educators, our seniors, our child care providers, including over 100 homebound visits for our residents who cannot leave their home. As hard as we've worked, we know that there is still some work left to do. And so last week we held our first mobile clinic for essential workers, and that was at the Northgate Shopping Center. And we plan to continue to replicate that model both at our food pantry and at our houses of worship. Our team of ambassadors and Inspection Services Department are working in collaboration to canvass businesses with eligible employees and provide more information and support in accessing an appointment. We've hired additional ambassadors to conduct multilingual community outreach and are partnering with the state, as the governor mentioned, to coordinate canvassing and actually go door to door in our neighborhoods to do outreach. And on Monday, we will be launching a multilingual public awareness campaign to reach our residents in public spaces, both in public spaces and in local businesses and on social media. Our community, as the governor alluded to, has been hard hit, one of the hardest hit in the entire Commonwealth, but the end is in sight. The governor, the lieutenant governor, Secretary Sudders, and Manny have been tremendous partners throughout this pandemic, and I want to thank them again for their support and thank them for the time that they've brought today to come together and see an end to this pandemic. Thank you.
Thank you, Mayor Arrigo. Thank you again, Governor Baker, Lieutenant Governor Polito, and Secretary Sudders, and my good friend, Senator Boncory, and our newest state rep, Jeff Turco. Once again, I just want to express my great appreciation for the state's support and resources that they've provided to make this site possible. Mayor Arrigo and the City of Revere, thank you again for your partnership as we work together to find the most ideal site for this community. I also want to express my thanks and gratitude to our Board of Directors, two of which are in the room today, Rita Sorrento, our Board Chair, and Jennifer Blanco, our Clerk of the Board. And as the Mayor mentioned, the team here at Oceanside Event Center for making this space available to us. And then finally, I just want to once again express my thanks and gratitude for the East Boston Neighborhood Health Center staff who have been on the front lines for 13 months fighting for our communities. You are truly my hero. And as the governor mentioned, the National Guard, who has been with us since the beginning and the opening of this site here, they are now officially members of the East Boston Neighborhood Health Center extended family. As Mayor Arrigo stated, this site is a regional, community-based vaccination access point, serving communities of Revere, Chelsea, East Boston, Everett, and Winthrop. East Boston Neighborhood Health Center operates 4 vaccine sites, and this is the largest in our network, representing 1/3 of the health center's vaccines capacity, which means over 2,000 doses per week. But it's not just about what this site affords to the community in terms of capacity, it's also where. When we think about equity in vaccine distribution, sometimes it's about location, location, location. For those who are not familiar with this room, it's been a well-known establishment for decades, hosting Latinx music events and other events that include salsa, tango, and ballroom dancing. Some of the things that make this great venue a success also make it a great vaccination site. Most notably, this site is next to the Wonderland T Station right on the Blue Line. This is important to us. Many that work or live in Revere and the surrounding communities take the T every day, commuting to essential jobs across the region. They're not working from home. They're in our grocery stores, our restaurants, and businesses that keep our communities moving. So instead of making them come to us, we're bringing the vaccine to them in a location that's close and convenient. And the data shows the impact that we're having. We've already vaccinated over 4,000 people at this site. And since eligibility expanded, we have seen an over 200% month-to-month increase in first doses received by Latinx persons. By far, the most significant growth of any racial or ethnic group. So it's time to get excited. It's our job now. It's our job now to maintain this momentum. It might be something about this site, but I've seen lots of people smiling and dancing on their way out. I asked everyone in this room, I asked everyone in Revere, to the surrounding communities across the Commonwealth, let's get excited, let's get vaccinated, and let's get back to normal. Together, through partnerships like this on display today, we have made such great progress. It's our job to make sure we keep moving forward, and we are ready. Most importantly, we are excited about the work ahead of us. Thank you again. Can't say it enough. Governor Baker, for your friendship and your partnership in this effort. Secretary Sudders, Lieutenant Governor, and the City of Revere for allowing us to be great partners in this effort. Thank you.
Representative Turco, you want to just take care of some business today? Okay. Questions?
I want to get your thoughts on sort of generally vaccine task force. We're hearing about New York rolling out the Excelsior Pass. Are there any plans for Massachusetts to do something similar? And are you still thinking maybe not mandating the vaccine for state workers?
We've said for a while that our primary focus is on getting people vaccinated, and I think it's perfectly appropriate for people to have conversations about some of these other issues, but I don't want them to distract from the goal that remains in front of all of us. I mean, we've vaccinated, fully vaccinated 1.5 million people in Massachusetts, which is a great thing, and we focused in particular on very particular populations to begin with, but, you know, to get to where we're going to be trying to get to here, we're talking about trying to vaccinate 5.5 million people. So there's a ton of work left to do here, and I really think the focus for us and for the Commonwealth generally should be on getting everybody who wants to get vaccinated as quickly as we possibly can. There's plenty of time to talk about some of this other stuff.
So is there any plan at all?
No. No.
Nothing like what New York has?
No. I want to vaccinate people. Let's get people vaccinated. I think having a conversation about creating a barrier before people have even had an opportunity to be eligible to be vaccinated, let's focus on getting people vaccinated.
What's the biggest obstacle to convince people? It seems like there's a large group of people that just don't want to get vaccinated for one reason or another. What do you have to do to convince them to get vaccinated?
Well, we've all seen a lot of the polling data, and the data I've seen basically says 3 or 4 things. It says there's a bunch of people who just don't want to go first. They haven't said no, they just don't want to go first. And my hope is more people in their community, whatever their community might be, get vaccinated. They'll look them up and down, realize that, it's okay, and they'll come out and get vaccinated. I think the more people that hear from their clinicians, that's usually one of the most important conversations people have about whether or not to get vaccinated. People will choose to get vaccinated. I think the third thing is, does it work? And the overwhelming evidence here in Massachusetts and everywhere else is people who are fully vaccinated and those folks who are part of the communities that we focused on straight out of the gate back in December have shown a remarkable reduction in both case counts and hospitalizations as a result of that. And the fourth, I think, is a more challenging piece, which is, trying to get the vaccine to people where they are. And we've talked a lot about this, especially when I've talked about the lack of availability with the J&J vaccine. It doesn't require the deep freeze. It doesn't require all the issues around prep. It doesn't require all the issues around storage. And it is a one dose. So as a tool in the toolbox to do heavy-duty mobility vaccinating, particularly with populations and in communities and neighborhoods where people can't get to wherever the vaccine is, that's a big opportunity. And I really do hope that as we move forward, we see more and more J&J in the mix. It is to go to senior centers and community centers and housing projects and all these places where a one-dose solution would actually be the sort of thing you could almost create a little bit of a rally around in those communities and in those particular places and spaces is very real, but it's really hard to do that. We are doing mobility work with the Pfizer stuff, and Moderna, but it's way more complicated. And to really scale that, the J&J piece could be a huge part of the answer there.
Governor, you've been proud of the efficiency of the vaccination, especially more toward the last few months. I've talked a little bit with CIC about they have an intention or a plan to do a drive-in at Gillette, maybe once you hit 16 plus and everyone's going to get it. Is that something you're looking at?
I think, tell me how much supply I have, okay? The biggest question mark with respect to how broad everybody can go on this is ultimately going to come down to supply. Now, the feds have made really clear that they view the retail pharmacy channel as the primary channel from their point of view with respect to geographic distribution. I mean, when they talk about on April 19th getting to the point where it's open for everybody should be open and eligible, which we think is great since we picked that day too. I'm glad they followed our lead. The big thing they say is by then, everybody in America will be within 5 miles of a site. And a huge part of the way they think about that is driven 100% by the pharmacy, the retail pharmacy rollout. They're also putting a lot of doses into community health centers, as are we, to make sure that we have plenty of available supply to serve those communities. But the more people talk about, where else and how else this can be done, for me, that all comes down to how much supply is actually going to be available through the state channel, which is the one that we actually have the ability to control and provide doses to. So there are a lot of things we could do if if the supply is available. But I'm hesitant to speak to any particular approach on this stuff until we see more visibility with regard to where we're going to be on supply, and especially the J&J piece.
Governor, thinking of April 19th, what's the warning to the public in terms of how long are they going to have to wait to actually have an appointment and get in the door? Is it 2 weeks, 4 weeks, end of May?
You know, I think I keep coming back to this issue around supply, and I know it sounds like a broken record, but we have the capacity right now in Massachusetts with the current infrastructure we have to probably double or even triple the number of doses we do. So if you think about the fact that we currently do somewhere around 60 to 90,000 doses a day, depending upon the day, I want you to think about the fact that right now, without adding a single additional, site in our current network, we could probably do double or triple that. So if the supply is there, our ability to vaccinate, and now tell me how much J&J we have, right? If Johnson & Johnson actually becomes one dose, if that becomes a big part of the distribution channel, think about the difference. And I've said this many times. I'm so grateful to Pfizer and Moderna for being there in December. But it's a 2-dose process, and it probably takes 6 weeks all in for somebody to get fully vaccinated. The Johnson & Johnson one is 1 dose in 2 weeks. So think about how fast, if you had a lot more of the J&J mixed in with the Pfizer and Moderna, you could move through populations and get fully vaccinated. So it's a hard question to answer, when are we going to get there without knowing the answer to some of these other things. I think by April 19th, I'm hoping we'll get more guidance from the feds about what they think the month of May is going to look like, because obviously that will be in many ways the first real opportunity we'll all have to vaccinate a population that's completely eligible. And that reminds me, a quick note on everybody becoming eligible on the 19th of April. If you are over the age of 65, if you're over the age of 55, I think it'd be great if you sign up, pre-register, get an appointment, and get vaccinated now that it's your turn. Because you are, based on all the data associated with vulnerable populations, among the most at risk when it comes to dealing with COVID. And I think it's really, we're thrilled that we're over 80% with that population. We're above the national average, but that still means there's a bunch of folks who are quite elderly who haven't signed up yet. I'm sure we'll find some of them with the homebound programming we're doing. I'm sure we'll find some of them in some of the work we're doing in congregate care facilities. But if you're one of those older folks, I really recommend you sign up and get vaccinated.
Governor, what's your reaction?
Let me just-
What's your reaction to people sort of quote unquote cutting the line, saying they have an illness or they've had some sort of a connection in a health center and they've been able to sort of jump the line and get a vaccination?
Well, I didn't jump the line. I think there's a reason why we have a process here. And I've had a number of people say to me, well, a lot of other states, everybody's eligible. Well, most of the states where everybody's eligible, we vaccinated a greater portion of our population than they have. It's just that we vaccinated more of what I consider to be the folks who are most at risk to suffer hospitalization or worse when it comes to COVID. So I think and I think people have been incredibly good about following the rules. All the way, from the beginning, here in Massachusetts, people have been great about following the rules. There are always going to be some people who, for whatever reason, don't. And the one thing I would say about the vaccine program is it is a limited supply program, which is one of the reasons why we have criteria in the first place. And if you cut the line and you're not eligible, you're basically taking a vaccine away from somebody who probably is vulnerable and probably ought to get the vaccine before you do, and I would prefer that people not do it. There has not been very much of that since the beginning of this, and I think that in some respects is a tribute to both the provider community that's doing the vaccinating as well as the people in Massachusetts who, as I've said, for the most part, follow the rules. But if you do that, you're cutting in front of somebody who probably is part of a population that really needs to get vaccinated.
Last question. On J&J, and the last week it was sort of a question mark as to whether how much more in Massachusetts is going to be getting as a result of this.
I think it's a pretty small number, isn't it?
Have they told you how many you can expect
I think it's like 18 or 12, isn't it? 12,000 and 4,000 the next 2 weeks.
Governor, have you thought about?
Which is part of why it's hard for me to answer your question and your question, because J&J is a perfect solution for both of those.
Governor, have you heard anything about, we've heard about a glitch in the pre-registration system for 16, 17-year-olds with a comorbidity, and it's emails are getting back to them saying you have to be 18 and over. Have you heard anything about that?
I haven't, we can look into it.
Emails on it.
Okay.
And then could the mayor, we could talk a little bit
Yeah.
more about the mobile vaccination program? This is part of FEMA.
So,
There's two of them.
yeah, we actually started homebound vaccinations several weeks ago, and that was in collaboration with our Board of Health, local Department of Health, and our fire department, and I believe Cataldo Ambulance. They went out as a group, and we were able to identify the population through our call center and reaching out to residents who maybe we knew couldn't get out of the house. So we've been doing that for several weeks, and we've partnered up with the state to continue to do mobile vaccinations.
And do you feel like, this is kind of a game changer for your community? How do you feel about this? What kind of a difference will you think this makes? We talked to you all year
Right.
long about how Revere is always in the red.
Right.
What kind of a difference will you?
Every shot that gets in an arm makes a difference, right? And however we do that, whether it be pop-up vaccination clinics at Northgate Shopping Center, where we're able to get a whole bunch of essential employees vaccinated, or go into somebody's house. Obviously, that's a little bit time-consuming, right? But we want to do everything, and every shot that we are able to administer makes a difference. So we're going to continue to do everything we can to get as many shots in the arms of our residents.
Thanks, everyone.
Governor, just before, Lance was more another gas release, just your thoughts on that. Is that going to be a problem now?
My understanding is the feds, which oversee the finished facility, are looking into that, and they did report the release to the folks at the state level, and we'll certainly follow up with the feds on it.
Is there anything they can do, because they are still operating after, this is now the third time that it's happening?
Like I said, at this point, it's a federally regulated operating facility, but they did notify us as they are required to do, and we'll certainly follow up with the feds with respect to what their plans are to deal with this going forward.
Thanks, guys.
Thanks, guys.
Thank you.